stratum functionalis. Okay, that is the one that is shed. Okay, and that's why I was telling you about the progesterone right there. Progesterone. It is affected by rising estrogen and progesterone. If progesterone dies, then the functionalis will shed, because progesterone, it is very important for the stratum functionalis to maintain and to grow. Okay, for the baby to be in there. No pregnancy and corpus luteum degree, causing progesterone to decline, and the endometrium dies. Okay, when that endometrium dies, which is the stratum functionalis will shed. So that's when you have the blood coming out, and that is your menses. Menstrual cycle. Now that you have all the pieces, you can understand the 3 phases. Okay, there's shed, rebuilding, and then preparing for implant. Here's that chart I was telling you about. The surge of the luteinizing hormone is what's caused the ovulation, which is the release of the egg. Okay. Typically 21 to 32 days. Controlled by granulosa and thecal cells. You remember in the male there is Leydig cells, and then there is the Sertoli cell. So make sure you know them for the tests. Okay, so this is the female part, thecal cell and granulosa cells. When you have your menses for 2 to 7 days, that's when you lost your stratum functionalis. So that's the layer that will shed. I have a video to show you as well. Happens during the early days of follicular phase, when progesterone, luteinizing hormone, and FSH are low. Recall that the corpus luteum has degraded, and this means progesterone drops, which triggered this. Proliferation phase. Next comes rebuilding. Can happen because the granulosa and thecal cell in the tertiary will start producing estrogen. The level of FSH and LH decline, then rise after one tertiary follicle will dominate. Remember, only one cell will dominate. Surge of the luteinizing hormone will trigger ovulation, which marks the end of this phase. Okay. So here's a diagram of, so after menses, okay, then we'll start rebuilding. Okay. Then at this stage, this is when the ovulation happens. Okay, if nothing happens, okay, if no pregnancy, then it will start declining, and the corpus luteum will die and turns into the corpus albicans. Secretory phase. The high estrogen, which trigger the luteinizing surge, starts uterine tube contraction, decreased acidity of the vagina. The luteinizing hormone causes the granulosa cell and to luteinize, and corpus luteum starts to make progesterone. Progesterone causes this phase. The endometrial gland makes glycagon, arteries develop for more blood and prepare for implantation. So the layer is thickened. If no fertilization, we end this with another menstrual cycle. Mammary gland. Of course, is for secreting milk. Contain alveolar glands. Also has the lactiferous duct. Estrogen stimulate breast development in female, and progesterone influence during this cycle. Here's the alveoli and the lactiferous gland, so that the milk will flow outward. And if you've been pregnant before, if you get one of these infected, it is extremely painful. I'm going to talk about different types of birth control. There's the rhythmic or rhythm method. Okay, require abstinence for sexual intercourse 2 days before and 1 day after ovulation, because the oocyte does not live very long. Actually, the advice is 5 days window around ovulation. Sperm can survive up to 72 to 96 hours. Oocyte only lasts 24 hours. Okay, you also need to have regular cycle and monitor your temperature, as your temperature will rise. Now there is mechanical barrier, including condoms, and so condom would also be a physical barrier. Okay, you can spermicide, diaphragm, and a cervical cap. So these are all mechanical or physical barrier. There's chemical barriers, spermicidal foam and sponges. And you can take hormones. Okay, there's oral, and you can take the pills. There's injection that you don't have to worry about. Protect against pregnancy for 3 months. And then there's IUD, which is inserted to surgery, and then it prevents the sperm from going in. But if it's misplaced, you're gonna get pregnant, and you might have pain and bleeding during. So again, here is the surgical portion. You cut the vas deferens. Okay, and then there is the tubal ligation. Okay. And of course, there are STDs. I think we're almost done. Oh, last slide. Okay. STDs, herpes, warts, and AIDS are all viruses, silent. Okay. Here are some of the symptoms if you have STD. But I think that's about it today.